It's okay to be going through what you're going through, and you're not the only one doing it.
Sometimes we're rough, sometimes we're down, sometimes we're low. I know we can be found. Sometimes we got joy, other time we don't know. But I tell you, I got something for you.
Most oftentimes we cover it up because we feel like we shouldn't feel this way, or we feel like we're the only ones going through this. But most often that's not the case. Millions and millions of college students, or just people throughout the United States right now, are feeling the same way you're feeling. And so it's just important that we start that conversation and then be willing to talk to our friends and family about it, because that'll really help improve your mental health and your mental well-being. Our minority populations are ones that most often do not seek mental health but could benefit from mental health. So it's kind of a double-edged sword there. Myself being Hispanic, I've seen that within my own culture, there's certain barriers and that inhibit people, from seeking mental health or understanding what mental health is.
As we all know, mental health is discussed more frequently now than ever. With the effects of COVID-19, the topic of mental health has increased drastically, with many people losing their jobs, isolated from their family and friends, and death due to the coronavirus. It has taken a toll on many families. I, Stephen Alexander, sat down with Frida Stevenson of Cedar Hill, Tennessee, to discuss the effects of COVID-19 and how it has affected her mentally. And here's what she shared.
The coronavirus has got me a little concerned and off track. I normally work from the office. However, because I don't have internet in my particular area, it's hard for me to actually work from home. So I had to find other projects that I could do offline in order to be able to have something to do here at home. I live in the country, and my area does not have internet or Wi-Fi at this time. They are working on it, but that's not helping me because I am unable to do my professional job without internet. So it's very difficult and stressful, needless to say. My actual profession, I am a clinical data specialist for cancer research at Vanderbilt University Medical Center. My job is I enter in information for those cancer patients who decide to go on a cancer trial. And of course, at work, where I have all of my supplies, things are easier for me. The dual monitors and patient charts, all of that source documentation is right there for me to work on. However, with working from home and not having the internet, that is challenging, needless to say, and I can't do my actual professional job. So it has impacted me in a tremendous way, but I have learned that through it all, things are going to get better, and I have something that I am working with my management with regard to cancer, so I still feel like I'm a part of the group and doing some of the positive things to help others. I'm so happy and grateful that I do have a job, even though I'm not able to do what I normally do. The point is that I have something that I can do and get paid for, which is what I am appreciative of. Well, honestly, I feel like with this pandemic that is going around, it is very easy for a person to be depressed, stressed, and uncertain as to what is going to happen, not only in their personal life, but their professional life. But I have come to realize that I have to stay positive and try my best to help those who are in need and myself as well. My son and I do a lot of communicating now and just talking about the things in general that goes on in the world. So I'm hoping that soon this will be over and people will learn that we need to work together, love each other more, and stay positive, not just because something is going on, but because we as people need to do better. A lot of people don't know this, but I actually have multiple sclerosis. And with multiple sclerosis, one of the things that keep the symptoms at bay is less stress. So with this coronavirus being in existence, needless to say, it has my stress level higher than normal and also can put you in a depressive state. But I try to find things to keep myself active and have positive thoughts. And my doctor has checked on me this week and told me that no matter what I do, if I feel that I'm in a high depressional state, to give her a call, but I'm not at that point. I'm thinking positive and know that things are going to work out for the better. The advice I would give people is be considerate. We are at home, but we have people on the front line who are working to save lives. We have people in the grocery stores who are working to put things on the shelf so we can have something to eat and to live comfortably during this time. So we, those of us that are not on the front line and at home, working from home, we need to be considerate and think about the people that's out there actually, they're putting their lives at risk. So we need to be more considerate, kind, and positive and do whatever we can to assist them in order to make their jobs a little bit easier, although that's hard to do. But if we do our part, they'll be more comfortable doing their part. I think it's sad that we don't take direction well. Sometimes we cause our own selves more harm than good because we don't listen. When someone is giving you factual, scientific information, it's for a reason that we listen and take heed and also do your research. They give you this information, but they still want you to read up and have the knowledge for yourself. Because I feel like if our government, our professional people are telling us what we should and shouldn't do to be safer, we as individuals should listen. Understand that this is a scary time, but if we follow the instructions that are given to us, be cautious, 6 feet apart, wash our hands, I think we'll be fine.
We always think of like, well, the first thing that we should do, that we should recommend is counseling. But before counseling is just taking it some time to like make yourself self-aware and evaluate yourself and your habits and creating healthy habits at home. A big part of that is sleep. So, you know, if you're not getting that 7 hours minimum of sleep, then maybe your mental health is off a little bit. So maybe you look at that. If you're not exercising, if you're not eating correctly, those are things that we should try to identify first. I think that the best way to support somebody with a mental health issue or problem is to do your best to be understanding, even if you think you cannot be empathetic or you can't be understanding of them. Do your best to create a safe space, an open space where they feel comfortable coming to you and talking to you, you know, a space that is free of judgment. Small changes are what matters. If that's exercise, you know, maybe you're going and taking a walk. But another piece of that is finding what works for you, finding your own coping mechanisms, finding how you handle stress. And that's different for everybody. So for some people it's music, for some people it's nature, for some people it's exercise. Tune in on that, and make that a priority.
During this crisis, we see scarcity of food, toilet paper, cleaning supplies, and many other items. I spoke with tenant farmer James Stevenson, who is also a citizen of Cedar Hill, Tennessee, the cousin of Frida Stevenson, and he shares how COVID-19 has impacted him both mentally and through his ability to upkeep a farm.
It's something definitely to be aware of as far as like just society and public humanity in general, honestly. But personally, it doesn't really affect me too much as a farmer, especially as a small business farmer. So I do everything basically out here by myself anyways. It's pretty much a work from home job. So it doesn't really affect me too much personally, but I can definitely see the effect that it's having on society as a whole, countries as a whole, this world as a whole. It's crazy. It's better than reality TV. I think it's just a different level of stress that people need to be aware of, because there's always going to be stress in life with or without what was going on. But a lot of people now are having to like slow down, and instead of just boom, 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 zapping and going everywhere all the time. So it's a different, it's a different mental state that you have to, you know, be aware of and cognitive within yourself. Because I mean, we all have stressful jobs, but now for a lot of people, they don't have a stressful job. They're at home stressed out. So it's a different type of, you know, stress management and just lifestyle management. Because, you know, a lot of these people will just let stress get to them worse than the actual COVID, you know. So it's just being aware of your own mental health and just staying mindful.
Yeah.
And staying in the moment too. Trying not to get too far ahead, not letting your mind just wander off too far. These larger, you know, farmers, because I farm livestock, you know, there's a lot of agricultural things that people don't think about. These farmers that hire employees to grow vegetables and fruit and things like that. So I'm not sure how they're going to manage that as far as paying employees, even getting employees out there to work, because these large groups aren't going to be large groups anymore. It's a whole different can of worms. I like where I'm at being a small town, because it doesn't hit me that hard. I'm not sure how they're going to deal with it, but they're going to find a way. I mean, that's what farmers do. They'll figure it out somehow. Take the country back to when people actually knew where their food came from. Oh man, you know, maybe down the road this could be an entire, you know, this is going to change a generation. You know, the kids that are in school, teenagers, you know, even, you know, 8, 9, 10-year-olds, they'll remember this moment for like the rest of their lives. So I'm sure it'll affect food, you know, food intake. It'll definitely affect the medical field. You know, there'll be a lot more, people will be a lot more cognizant. I mean, this is the type of disease you can't even hang around people with and you can get it. Yeah, people will be, hopefully, most people in general will be a lot more aware. Well, you can only take care of others as well as you take care of yourself. So take care of yourself, but don't be too selfish. Also, remain humble, true, and just be honest. As long as you keep those basic things going every day, we'll all be all right.